I call it the hostess with the mostest. And so I really, truly want to thank you all for believing in the organization, for believing in what we're doing enough to put your whole into it. Susan is a friend slash mentor who I adore dearly. I adore our relationship, where it's grown, where it continues to grow. Sam, I had the opportunity to work with at UH and train. So I truly, truly want to thank you guys for agreeing to do this and to continue to do it for us. I do want to acknowledge our staff that's here as well. I think this goes to the commitment of the organization, the people that come out on the weekends at 10 o'clock on a Saturday to support us and do the work for us. Jacqueline Bradshaw, our Director of Programs and Grants Management. Sheila Jones, my right hand, left hand, front and back executive admin. Greg Ainsley, our CFO. And then recording, and we'll ask you probably a bunch of questions with the camera. Daniel Banks, our Director of PR and Marketing. So thank you guys so much. And then always acknowledging our board members who tirelessly show up for us, tirelessly are out trying to get the word out. Valisa, who you all heard from, Brittany Long. I think it goes to show over 50% of my board is also patients. So I think that also goes to show the commitment that we all have to what we're doing. Some of you might have, well, I think most of you have never heard my story of why I started Village of Healing. And I started Village of Healing after visiting Africa, Ghana to be specific. And I visited the slave dungeon. And it was in that moment that I stood at, there's a big gate that says a point of no return. It was at that gate, and then they had us in the dungeon where they kept the problematic or the black women who weren't disciplined, is what they called it. And I laughed to myself as I was standing in this room because I was like, I definitely would have been in here, I'm sure, every day. But it was in that moment that I had an experience where I heard my ancestors talk to me and say, so this is your legacy now. We've done all of this, now what are you going to do with this? And so when I returned to home, COVID happened, and I saw the disparity in the hospital system myself of how the black patients were treated versus everyone else. How they weren't allowed to bring a support person. And if that support person came, it was questioned. Well, you know, they like to party on the weekends, and so they might be bringing COVID to us. And I remember visiting the suburb clinic, and they had like 2 and 3 support women or support people in the exam rooms, and when they delivered, it was never a problem. And at the same time, as being a worker in the hospital system, and I've been a midwife now for almost 20 years, which is so hard to believe saying out loud. I was also a caregiver. My grandmother had recently been diagnosed with dementia, and so I was going back and forth to the doctor's visits and hospitals with her, and I was demanding her care. I had to demand them to do things. I had to demand them to really truly listen to us. And at the same time, my uncle had started having mini strokes and was being set up for his largest stroke, which he had, while I happened to be in the hospital. And I walked into the room, and just from what they were telling me, I was like, he probably just had a stroke. He has uncontrolled diabetes, uncontrolled high blood pressure. I was already prepared, like I'm sure they, you know, because the first couple minutes of the stroke are everything. We learned this, we know this from nursing school. That they probably have already started the medicine guys, and I'm on my way. And I walked in, and my uncle, who is like this huge man in my life, is sitting there naked, holding a gown and saying, they just gave this to me and I don't know what to do with it. And so it was in that moment that I was like, they have not started anything. And so I knew that we deserved a healthcare system that listened to us, that respected us, and wanted to see us healthy as everyone else. And at the same time, I was going to all these meetings around infant and maternal mortality, because dollars were starting to come out from the government surrounding the issue. And so now everybody wants to talk about it, but nobody in the room looked like the communities that were being ravished with infant and maternal mortality. And at dinner, the conversations that me and my friends were having were, I don't think I'm gonna do it because I want to survive. I don't think I'm ready to have children because I don't know if I'll make it to even raise them. And then most importantly, I don't want to do it because if I have a black young male, I don't know if he'll make it to 18. And so I decided then I needed to do something. And so we started Village of Healing with the intent to just do community programming around mental health. Because I also felt like it was a lot playing on us as black women in our mental health. From there, Bloomberg came out with their study to say that Cleveland, Ohio is the worst place to live for black women. Second to last in healthcare. And I remember sitting in a meeting and the chair of the department was like, that is such bull, that's not true. I don't know where they got those numbers from. And it was a meeting of about 22 of us, and 2 of us are black, and we gave each other looks across the table like, now he knows, you know. And so I knew I needed to do something. And this was all playing back to Africa with my ancestors saying, this is now your legacy. And so we were able to start the Village of Healing Center. Because the research was also saying when your provider looks like you, your disparities decrease, your outcomes are better, your patient satisfaction is better. We also know that when you invest in the disparities, for marginalized communities, the disparities for everyone else gets better. And that's just automatic. It's research. We've seen it in Cleveland and Calvin County. From the investments that have gone into infant and maternal mortality, the white disparity has decreased drastically. And so we started the Village of Healing Center February 14th, 2022. It's all a blur now. February 14th of 2022. We started with the hope to just see about 40 black women. That was going to be me putting my stamp in Cleveland on infant and maternal health. Someone would come along and they would say, this is an amazing idea, we'll take it from here. In that first year, we saw 640 women. And nobody came along and said, we'll take it from here. And so we did something that's actually kind of crazy. We started listening to patients who were coming into the clinic saying, why doesn't somewhere like this exist for my husband, my brother, my nephew, my child? And black women were coming in for the first time, and I call it the shoulder drop phenomenon. Like, as soon as I come in the room, you can physically see shoulders drop. You can physically see tears. And they were like, I was going to come in here and feed you a story, but nope, I'm giving you it all. I'm going to put it all on your doorstep. And so what we've been able to do is add primary care, pediatrics, and mental health since we've opened our doors. Our outcomes prove it. We're now getting ready to work with Case Western Reserve University, a research team to really dive into it. But last year we had a 95% term birth rate, so 95% of the babies that we took care of delivered term. Cleveland, the city of Cleveland, I think is around 84, 86%, and they're just hoping to get to 90. So we superseded that. Our diabetes control rates are 75%. And as somebody that was born into a family where it feels like everybody is a diabetic, that is just such amazing news. Her hypertension control rates she has a 15% increase. I'm one of those, as you saw in the clubhouse. When you were talking about your blood pressure, I laughed because I lost 60 pounds, started Village of Healing, and got high blood pressure. And so it was so difficult to control. And I remember Amber kept saying, I need you to decrease your stress. And I was like, I need that to happen too. And so, but we figured it out. And so my blood pressure rates are controlled, my BMI is down. So the care that we provide is needed, and we see it. We hear it from our patients. We hear it from the community. It's something when the hospital systems are referring patients back to you. Like, that's huge. Our partnership with Cleveland Clinic is simply amazing. I can email them today and say, I had a patient with a horrible experience. They're calling a big meeting with the chair, the vice chair, who's over the labor and delivery. And they're sitting down and they're listening to us. And so we're really, really excited about where we're going, what we're doing. We've now opened our second location in the Buckeye Shaker neighborhood. And we're still sought after in other cities. We were originally going to Youngstown. We got a little derailed. But they're still, their community is saying, can you take a step back and let us handle it? We'll go to the mayor. We're going to city council. We need you. And so other people are seeing that we truly, truly work. What we've created at Village of Healing is more than a healthcare organization. It is a first of its kind, innovative model. I love Sam said revolutionary, because I definitely think it's that. With the power to transform what healthcare looks like in Cleveland and beyond. We have been described as a unicorn. That's what our researchers said. They just knew when they looked, they would find somewhere else in the United States where this exists. They were like, they are literally nowhere. This is a unicorn. Because there is truly nothing else like it. And this groundbreaking work is not happening somewhere across the country. It's happening right here in our own backyard. And it's the city surrounded by 4 major hospital systems. By choosing to be here today, you've already acknowledged that what currently exists is simply not good enough for every member of our community. You now have the opportunity to become an early investor in a model that is building something better from the ground up. A healthcare system that hears the Black community, sees us, respects us, and provides the care and resources necessary for families to become healthy and whole. For centuries, healthcare has failed and harmed many of our neighbors. Village of Healing is proving that another way is possible. This is your opportunity to get in at the ground level of something truly transformative, to help shape, strengthen, and sustain a model that can change healthcare in Cleveland and ultimately become an example for communities across the country. You are not simply supporting an organization. You are investing in the future of healthcare and helping us prove what equitable, community-centered care can and should look like for everyone. Before we close, I want to leave you with a few meaningful ways that you can become a part of the Village of Healing story. My board chair says action steps. That's her favorite. She's like, what are our action steps? The work we do is deeply personal to me. I started Village of Healing because I knew that our community deserves better access, better care, better experiences, and better outcomes. We have seen what is possible when people receive care that respects who we are, listens to their concerns, and responds to the realities of their lives. And while our work is centered on improving outcomes in the Black community, the impact extends far beyond our community. When we address disparities, strengthen access to care, and improve health outcomes for those who have historically experienced the greatest barriers, we create a stronger and healthier healthcare system for all, for everyone. So I'm asking you to consider taking action in one or more of the 4 ways. First, I'm asking you to make a financial contribution to Village of Healing. Every single gift matters, regardless of its size. Your contribution helps us continue providing care, connecting families to resources, expanding our programs, and responding to the needs of our community. If you would like to make a donation today, there are QR codes all over, and please also you can see one of our staff. Second, I'm asking you to consider becoming a monthly donor. Monthly giving is one of the most powerful ways to support a nonprofit organization because it involves sustainability. It always allows us to plan, prepare, and sustain our work beyond a single event or grant cycle. A monthly gift creates reliable support that helps us keep our doors open and continue providing care throughout the year. Third, and I think for me this is one of the most important, is I'm asking you to introduce us to 4 people in your network. Think about 4 people who care about health care, maternal and family health, reducing disparities, improving outcomes, or investing in organizations that are creating measurable change. An introduction from someone they know and trust can open a door that we may never be able to open on our own.
And finally, I'm asking you to consider hosting a private gathering like this for Village of Healing. It could be in your home, at your workplace, or at another space where you bring together friends, colleagues, or your community members who may be interested in our work. We will come to you, share our story, answer questions, and help your guests understand the impact of their support. Village of Healing was founded because I believe that better outcomes were possible, and we're seeing it currently right now. Today we have the results to prove it, but we cannot continue to grow or do this work alone. We need people who are willing to invest, make introductions, open doors, and use their influence to help us reach the families who need us. Thank you for being here, thank you for listening, and most importantly, thank you for considering how you can become a part of our village. So thank you all so much.